Hi there, my name is Dr. Paul Dhillon. I'm a rural family physician in Sechelt, BC, and I was asked to talk a little bit about my involvement in the Vancouver Convention Centre, which we turned into a unconventional care space during the COVID-19 pandemic. Luckily, we didn't have to open it. We didn't have to accept any patients, but it was a very unique opportunity to go from 0 to 100 in building an alternative care space, as we called it, for the COVID-19 pandemic. So my initial involvement came through my previous training in disaster medicine, my involvement with the military and working in kind of austere environments, and led to this incredible opportunity as a family physician to be really there working through the nuts and bolts of how do you build a hospital in a pandemic. One of the greatest things about the actual experience was the new relationships that were formed, and also those that I was able to kind of bring in from different experiences. And I think as primary care practitioners, we have links to not only all of the different allied healthcare providers, but also in our smaller communities to our local fire department, our local search and rescue. People know who we are and they trust us, and that really comes to the fore when you're in a crisis situation, trying to use those relationships and leverage them to build something brand new in a high stress environment. So I think a lot of the stuff that we do as family physicians is really relationship building, and that really comes to kind of a positive effect when putting together something like the convention center. There's multiple stakeholders. So this was a little bit new for me, is that we weren't only dealing with allied healthcare providers, you're dealing with the health region. And then you're also on top of that, there's a complex layer of government that you may have to deal with. And that may be at the national, provincial, or even municipal level. And you need to know how to approach these stakeholders. You need to know what their values are, what their goals are, what they want out of it, what they can provide, but also what you can give to them. So working with these different stakeholders, you're going to be dealing with the public, you're going to be dealing with the media, you're going to be dealing with different communication strategies and goals. So bringing them all together, having very tight, clear deadlines, and then being able to run a meeting that gets you to the outcome that you want, which is going to be potentially a disaster care area or some hospital alternative care space. And bringing people together very quickly can be a challenge. And then building those relationships in advance can have huge benefits. So some of the key things I want people to remember is to be prepared, to inquire in advance, and to plan. Planning, a lot of people say, like, why are you planning? You're planning, we need to be doing something. Taking that tiny bit of time to actually sit down, make a plan, bring everyone together, challenge yourself and say, what are the strong parts? What are the weak parts? What are your constraints? What are your restraints? In order to put together this effective plan will have great benefits downstream. So don't feel that time wasted planning is actually wasted. Be prepared in advance. Inquire, talk to your local communities. There are programs I know in BC where smaller communities are working together with the medical institution to say, what are we going to do in a disaster? So becoming involved in that, even in a small way, will give you that kind of big picture, the idea of what's going to happen if there is a disaster in the future. If anyone does have any interest in reading, we did publish a paper with some of our kind of lessons learned, the Vancouver Convention Centre COVID-19 response, planning, implementation, and kind of 4 lessons learned. What I'll highlight just in this one is some of the neat things that kind of came up that I wouldn't have thought of. So we think of respiratory illness. How are we going to get oxygen when everybody wants oxygen out to an alternative care site? The next thing is fire. You're going to want to have your fire department, before any new building or space is set up, the fire department is going to have to sign off on it and say, where are your fire exits? How are you going to move all these patients who are in beds in a non-hospital environment? So you've got to get them involved. And then contracts. This was something that was kind of new to me, but we wanted to have volunteers come in a disaster context. And so what we needed to do was to develop those contracts. So that's a great opportunity in advance of anything happening to have some on-the-shelf contracts to build the relationships with the external providers you have in your environment, and possibly even volunteers who are going to want to come out and help, but build the structure for them to help in advance. That's all. Please have a read of the article, and I hope you enjoy the rest of this presentation block. Cheers.